My name is Felicia Jones, and I am an occupational therapist in Atlanta, Georgia. I'm currently enrolled in a doctorate program at Chatham University, and this short YouTube video is actually to support my dissertation project. My project is going to be on improving the competency and confidence of occupational therapists to implement sleep hygiene and mindfulness interventions with older adults. Part of my project is going to be providing online modules to educate occupational therapists and then testing their improved knowledge after they complete the education. So I wanted to again make this short YouTube video to support that project. After you listen to this video, there is a link in the notes below to take a brief survey to test your knowledge, and hopefully you learned something after viewing this video today. So I am going to be talking about different sleep hygiene and mindfulness interventions. So I thought it's only fitting to do that from the comfort of my bedroom, where sleep is such an important occupation of rest and sleep. And I wanted to make sure that I addressed it with all the occupational therapists out there who happen to stumble across this video. So I'll go ahead and get started. What I want to talk about a little bit today is just our role as occupational therapists to address this very important domain. The occupational therapy practice framework included the domain of rest and sleep because so much happens from a restorative standpoint when you rest and you sleep, and it's something that affects our clients every day. So that's going to be part of this video that you're viewing. I also want to go over different strategies that fall underneath cognitive behavioral therapy for insomnia and how occupational therapists can implement those strategies. And part of cognitive behavioral therapy for insomnia, and I will just shorten that to CBTI, is there's the domain of sleep hygiene and also mindfulness. Those strategies fall underneath CBTI. And so I'm going to talk about sleep hygiene interventions and mindfulness interventions next. So you probably heard of sleep hygiene. I know I did, especially when I completed my master's program in occupational therapy, which was, long time ago. But I remember reading about it in school and learning about it, and sometimes I would use it with my clients. But there's just so many other factors that sometimes take precedence over sleep that I'm looking at, and sometimes I don't always address it myself. And so knowing and learning how sleep impacts me from a daily standpoint, and then also applying that to older adults, it's something that we have to address. And hopefully after watching this video, you'll understand why. So sleep hygiene interventions. I'm going to just touch on a couple different ones. And the first one is helping our clients establish a daily routine and habit. Routines and habits are things that occupational therapists is our bread and butter. We know how to do this all the time with any other issues, but taking that skill set that we have with implementing a routine, but applying it to sleep, setting a bedtime routine and a schedule, helping our clients understand going to bed and waking up every day at the same time is going to help them. Another sleep hygiene strategy that's been shown effective in the research is to just expose our clients to sunlight. Getting older adults outside for at least 30 minutes every day has shown to help set their wake and sleep cycles. This is really, I think about a lot of times with physical therapy, getting the client outside and walking, but also as occupational therapists, if there's a intervention that I'm doing, can I do this intervention outside? Do I have to do it in the client's apartment? And so getting older adults outside for 30 minutes of exposure every day will help them reset their circadian rhythm and get them on schedule for wake time and sleep time naturally. Another sleep hygiene intervention that you can use with your clients is to limit fluid intake 2 to 4 hours before going to bed. And this sometimes can be a catch-22, especially with older adults, because dehydration is an issue, but also waking up throughout the night frequently is also an issue. So understanding that, okay, if I can at least eliminate their fluids 2 hours before bed, set them on a pretty nice routine where I implement drinking water throughout the day before that 2-hour window, I might be able to help them not wake up to go to the bathroom as frequently. As an older adult, maybe getting up twice throughout the night, 1 to 2 times is typical, but anything above that is really, really impacting their quality of sleep. So, reducing fluids 2 to 4 hours at night is another strategy. Also, throughout this project, I've learned how diet can impact sleep. Teaching our clients to have more protein throughout the morning times and vitamin C in the morning, but also switching their diet to having more complex carbs at nighttime will help them rest and sleep. Another strategy that you can use for sleep hygiene is journaling. With cognitive behavior therapy, a lot of times it's about channeling those negative thoughts. When you have insomnia, you associate your bed with something negative. You're not sleeping in it, so it's negative to you. So incorporating journaling, something that's positive and something that's relaxing, will help to sometimes calm the mind and help them rest better at night. Also, journaling any types of to-do lists or things they have to do the next day might help them filter that out of their mind where they can actually turn it off and rest. Another thing which I'm sure you guys might have heard about already is just reducing screen time. Limiting your screens from a tablet, Kindle, television, anything that has a screen to it emits a blue light. Well, that blue light that's coming through the tablet is naturally disrupting your melatonin. And so melatonin is what helps you fall asleep and stay asleep. And so it's very important that some of those environmental factors we eliminate with our routine and our schedule. So if you have a client who really wants to use their tablet, we'll find a time throughout the day that's meaningful to them, that they can use it, but make sure it's at least 1 hour before they have to go to bed. So those are just some basic sleep hygiene strategies. Another strategy I want to teach you about a little bit more is mindfulness. There's been a lot of research lately with mindfulness and just the benefits that it has. I know even throughout this dissertation project and being in the doctorate program, I've had to use mindfulness quite a bit to help me rest at night. And it's a really easy strategy to teach older adults how to do. There are many forms of it on our smartphones and things that we can use, but with older adults, sometimes there's not always as much access to technology. So teaching them how to do it with deep breathing and relaxation strategies have been shown to be effective with sleep hygiene to help your client get better rest. So one of the strategies for deep breathing, I love it, is because deep breathing is a free way to turn your mind and slow down your heart rate, slow down your breathing, so any type of anxiety or anxiousness that you feel, automatically it starts to go away. And how it does this automatically is because deep, slow breathing actually triggers your it triggers your parasympathetic nervous system, or your PNS, and that system is in charge for slowing down the heart rate, slowing down your breathing. So when you do it, when you exhale slowly, inhale and exhale longer, you're tricking your body to slow down. So an easy way I teach my clients how to do this is to inhale for 2 counts, but to exhale slow for 4 counts. And this also is called diaphragmatic breathing because it's a really good way to get oxygen in and push it all out slowly while helping their bodies calm down. So it looks a little bit something like this. You want to inhale for 2 counts and exhale for 4. So it's a okay. You're really going to push all that air out, and doing that over and over again if they're anxious will help just calm their bodies down and trigger that parasympathetic nervous system to help them relax. Another reason to implement sleep hygiene and mindfulness interventions is because the research is pointing to more negative effects with using medications for sleep from a long-term standpoint. Sleep medications are, sometimes needed, and it's definitely something you want to consult with your physicians with at any time you're thinking about using them, but also having some methods that you can use that are not medication, because some of the research has shown that medication can kind of restructure your sleep architecture and how you naturally would do it. And so you want to talk with your physician about, okay, I need this medication now, but then also asking them for a intervention for, a therapy referral for occupational therapy to maybe go over some sleep hygiene strategies with you in combination with your sleep medications and see if we can find a really good fit. So all of this information on sleep is very exciting because when we get sleep, we're restored. We feel better. When I don't get sleep, I know personally I'm not as effective as I could be. And so understanding how our clients are impacted by not getting sleep is a really important part of occupational therapy. So some functional limitations and outcomes that can occur for not getting sleep is you're going to see increase in fall risk. That's huge. When you're sleeping, your body has to go through different stages of sleep. And there's 4 stages. You've got stage 1, stage 2, stage 3, and then you also have REM sleep, or your rapid eye movement. And so stage 1 and 2, you're kind of moving in and out of consciousness and some good things are going on. But stage 3 is that deep, slow wave sleep where your body is going through a restorative phase. You're repairing your body from everything it's been exposed to throughout the day. Your tissues are rejuvenating. If you have an infection, your immune system is trying to build up to fight it. So if you have a UTI and you're not getting sleep, then you're kind of setting yourself up for not healing properly because you're not getting that deep restorative sleep. The second part of sleep that's very important is your REM cycle. During REM cycle is when you process the emotions and the stress of your day. That's when you have your dreams as well. And so not getting that stage 3 in those REM cycles of sleep, it really sets you up for a bad day the next day. And one of the challenges that sometimes older adults have is that they have more interruptions throughout the night. So if you are not properly managing their fluids and they're getting up 3-4 times throughout the night, every time they wake up, they have to start that stage of sleep all over. So they might have been in stage 3, but when they get up again, they start back at 1 and they have to restart. So imagine if you're waking up 3-4 times at night, you might be not even getting to stage 3. And so this is something that as occupational therapists, addressing quality of sleep is going to help our clients have more quality of life the next day. It's going to help reduce falls. It's going to help improve engagement. Just being present with whoever they have in their lives. And so my ask of you after watching this video is to just think about, when you're doing an intervention and you're doing an evaluation, just completing that full occupational therapy profile and figuring out okay, did I ask them about sleep? If I didn't, let me make sure on the second visit or the third visit or the fourth visit that I'm going to address it eventually and write a goal for it. It is within our scope of practice to address. And so making sure that we do that with our clients when we have the time to will really help them live a better quality of life. So I really hope you enjoyed this video. Again, down below, there's a list of references for everything that I talked about today. And then also there's a link to a quiz to test your knowledge. So again, thank you so much and have a great night. Bye.